Governor. My name is Carrie Hona. I'm from Torrington. I want to welcome you to our city. We're thrilled to have you here. It's nice to have someone come out here once in a while. I'm a mother of 2 small children.
Now, wait. I was here at the newspaper a couple of weeks ago. This is my second time in a couple of weeks. I want more credit than that.
I'm a mother of 2 small children. I want to commend you for creating a budget that really does make some tough decisions to ensure that Connecticut's going to be a great place to raise our family. But with that being said, I want to thank you for your support of Sustanet during your campaign. We know that this is a tough budget. We're all facing tough times. We all know people that are out of work. But I want to ask you, I know that Sustanet saves the state money, as well as you know that, as well as making our communities and the individuals that we live next to healthier. And I want to ask you what we can do to help you make sure that Sustanet and healthcare reform in Connecticut is a reality.
Well, what I would say to you about Sustanet is this, that I am working day and night to try to fully understand and be a leader in implementing the federal changes that have come about and to take advantage on behalf of the people of Connecticut of every federal dollar that we could pull into this state to provide that kind of health care. And this budget assumes much of those savings. And I'm proud to say that we had joined a collaborative under my predecessor in December, and we were chosen as part of that collaborative to share in the $37 million that will be distributed in New England to move our states along more rapidly in introducing that system. I'm trying to get that all absorbed, quite frankly. I remain committed to the idea that every person in Connecticut would have access to health care. So I have this desire to meet one set of needs, and I have this legal requirement to absorb this other set, and I'm trying to find the right balance, and that's why I appointed Jeanette De Jesus, who has been active in healthcare in many different arenas, to lead that effort, along with the lady who's standing next to you, who chaired the Sustanet Committee, and we're trying to find the right level. You might be absolutely correct, and I hope you are, that in the long run, Sustanet would save us money. I have to tell you, in the short run, it would come at an extensive cost. And it's that cost right now, with all of these people in the room, that I'm trying to manage. And so I'm not less committed to health care. I'm trying to absorb the first fight first. Thank you.
Good evening, Governor. My name is Joe Freesia from the city of Torrington.
Hi, Mr. Freesia.
I appreciate
Do you have any relatives in Stamford?
No, I wish I did.
Okay. There's a bunch of Freesias. Freesias thought about it.
We're very fond of Colony Grill pizza also.
Okay.
I appreciate this opportunity. One thing I'd like you to consider, I believe tolls in Connecticut is a smart move. With that being said, it's not to put a burden on the people of Connecticut, it's to put a burden on the people that fly through Connecticut all day long, up and down 84, up and down 95. What I propose is this: set up a toll booth with the Easy Pass, with the license plate photography at the borders, just on 95 and 84, and I think that you will be able to generate a vast sum of additional dollars. With that being said, I would like you to consider eliminating the state's emission testing program. Yeah, just about every car in the state of Connecticut are clean running. I would recommend you take a small portion of the toll receipts and use that money to institute a vehicle safety inspection program. 70% of the cars and light-duty trucks on Connecticut roads have genuine safety issues that are not being addressed. Make our roads safe for the citizens of Connecticut. Thank you, sir.
Mr. Freesia, thank you very much. Let me say a couple of things about tolls. They're not in this budget because the approval process to add tolls in Connecticut would probably stretch out over a 4-year period of time. And since it was not a revenue item in the 2 years of the biennium budget, I really needed to put some things aside. So we put that aside because there was no way that we would recognize any toll revenue in this 2 years of the biennium budget. Having said that, I have to tell you, when it comes to tolls, I don't think tolls are a good way to raise general revenue. I I do think if we're going to have tolls, we need to dedicate that money to transportation. We have a transportation system that is woefully inadequate and actually puts Connecticut at a deficit compared to other states in New England when it comes to competing for jobs. That's one thing I would say about it. We need to lockbox, even change our Constitution to make sure that those monies weren't rated for other purposes. Final thing I would say to you, I am open to tolls in one other set of circumstances, and that would be for new roads or new investments. Route 11 happens to be a different part of the state, out in the southeastern portion, hasn't been completed for 30 years over multiple administrations. I'd like to see that road completed. We don't have the money to do it. That's a situation where I would, in fact, entertain a private-public partnership or the possibility of tolls. That would be the exception, and that could be permitted much more rapidly by the federal government than any of the others. I appreciate your sentiment, Mr. Friedrich.